Hey, all right. Hello, everybody. Hello, hello, hello. I think I have to activate the chat as well. Let's see. Um, Hello, everybody. Welcome. I'm just trying to get things situated here. Are you guys able to type in the chat? Oh, hi, Michelle. It brought you back on again.
Well, it didn't give me an option to not. So this is the link it sent me even when I went back through the
That's
website.
so funny. That's so funny. Okay,
Uh,
great. Are you guys able to, there we go. Attendees can chat. There we go. Okay. You guys can hear me and see me if you can. There we go. Type in the chat. Yay. Hooray, everyone. I did it. Hooray, hooray,
There's a
hooray.
bunch
Okay.
of people. I see them all.
Yay. Good job, Teresa. We did it. Way, yay. Thank you. And then I just got a million messages that you guys could use the chat. I love Zoom sometimes. Awesome. Thank you guys so much for being on. I am so excited. I have not been this excited about new stuff in a very long time. We started the collective, what, 8 years ago, which is just insanity to think about. But, times have changed so much in just the world and what online education looks like these days and what you guys are wanting as, credit to medical speech pathologists that are growing and changing and advancing their own knowledge. So we have to do our part to keep up with what you guys are all doing. So I'm so excited to share with you all our new features inside of the MedSLP Collective. So we'll be talking about it over the next few days. And tonight specifically, I brought on Dr. Kristen West. She has been with us in the collective since the beginning as well. And she's actually now our lead mentor because we've brought in all brand new mentors within the collective too. If you guys have not noticed that with inside the Facebook group, our new standard is same day responses, much more robust responses. Some of you are getting video responses, which just makes my heart so happy. We've really elevated our standards here at the collective, which I'm so proud of. And I can't thank Kristen enough for helping out with that as well. That being said, she's also helped us to put together these new simulations that we are going to be releasing for you guys. And Chris and I are going to talk about that, really the impetus behind that a little bit. And we're going to show you a little bit of it. We actually can't show you the whole thing because they will be for CEUs and we can't give you the answers of the CEU simulations. So I'm going to stop blabbing about this because honestly, Kristen is the brains behind all of this. I am just here to help host and say hi to all of you guys and thank you all for your loyalty and your support all of these years. And thank you for supporting us into trying new things. And like I said, this is the first live unveiling of our new simulations, our new clinical simulations. These are going to be a work in progress. We are going to keep adapting them. We are going to keep changing them as we find new technology, as people request different clinical scenarios. So please do continue to give us feedback on how you're liking these. So I'm going to stop blabbing. Go ahead, Kristen, take it away.
Yeah.
And I need a
Just
drink because, as always, I have horrible vocal hygiene when I'm live on these things. So I'm going to mute myself and take a drink. So go ahead.
That's all right. Hi, everyone. Welcome. Thanks for joining us. One of the things that, is kind of behind the impetus for a lot of change that, you've already seen in the collective and you will see in the coming days is really this shift to active learning. What we really know best and know about just kind of how do we take the research and make it applicable and how do we, change practice and really help people elevate their clinical skills and training, whether that be, through the graduate education lens or through just our clinical practice, is really making sure that we can make education active learning. So taking what you're learning and turning it around and being able to applying it. But for years, CEUs and kind of our slant on education has been more passive, right? We sit through a lecture, we take some notes, we review a handout later, and then kind of walk away and we're like, how do I do this with the person that I have in front of me? What does this actually look like? Or, ooh, like I didn't really think about how I would navigate this clinical scenario, but now I'm home and, working with my caseload and there it is in front of me. And so what we really know kind of about the traditional way of learning is that it's really good for short-term retention, but it doesn't always translate into that applied skill. But we know kind of in the background that to learning, that's where it is, right? Not just here's what you need to do, but how can I do it? How can I apply some of that? And so you're going to have some great opportunities to see demos and discusses, which help address that. But another way to really do that is through case-based interactive learning. Simulation is something, and really, simulation is something we see a lot in educational spaces. It's something that we use in our grad programs a lot. That we really use to help kind of take that information and make it applicable. But really blending case-based learning with simulation style videos really helps you bring that information to the forefront. So instead of just, learning about a specific approach or reading it in an article or sitting down and hearing about it, you kind of get immersed in this real scenario where you hit a crux in the road, just like you do with your patients. And it's, what should I do next? What questions should I ask this person next? Or which assessment should I choose, or what path kind of through this diagnostic workup should I take? And you kind of get the chance to navigate that. And so kind of the rationale behind this like case-based simulation style video learning is really just that. It's not just sit and be told, but it's take what you know, take what you've learned, take all the amazing resources that we have in the collective, all of the CEUs that, we have had done in the past. And how do I now apply this? So let me give you a case. Let me actually say, well, in this situation, what are you going to do next? How are you going to walk that through? And one of the interesting things is, through that, as you make decisions, it'll give you feedback. It'll say, oh, this was the correct answer because XYZ, or I see where you're going here, but maybe you need to consider this aspect of the client's care or this aspect of the patient, and really kind of drive that. What do I actually do? But it puts you in that errorless learning kind of space where you can work through that case. And it's not a patient that's sitting in front of you. So if it's something that you're unfamiliar with, you get it wrong, you get to go back and figure it out and try it again. Although, kind of being there to really help you really put what you're learning into practice. So it's something that we've seen a lot in, in graduate education. It's something that is becoming kind of the norm. It's how we've all done our CPR training for years, right? The dummy comes out and we pump the dummy and they give us a scenario and we figure out what that looks like. But really just taking that education to the next level and really helping us apply what we're learning and really building that clinical reasoning and applying that evidence-based practice. So, you can kind of take those skills and use them tomorrow. That's kind of, and I'm probably stealing Teresa's thunder here a little bit, but it's everything that's coming forward. So this is just one piece of that larger.
Yeah, no, I love it because we did have some members freak out, and I want to make sure you guys know that we are not throwing the baby out with the bathwater. That's a horrible saying. I can't stand that saying. Anyways, all of the resources and webinars that are in the site are staying in there. We are going to be making some adjustments over the next few months just to make things more organized. But what I love about making the shift is all of that is still there. So if you guys realize, if we have one of these, clinical scenarios, one of these case simulations that is maybe about tracheostomy care. I'm literally just throwing something out there. And you realize I'm really not strong in trach care. I really don't know much about trachs. You can still go back to the resource library. You can go back and watch a webinar about that. So we are not getting rid of that stuff. We are progressing and elevating to the next level of MedSLP education. We have dumped you guys with PDFs and webinars for 8 years now. So now it's time to actually apply what we have. So
yeah. And I think that's really kind of, what we see and kind of just what we know about education and what we know about where things need to be is that people are asking for, I want that thing. How do I do it tomorrow? I want to know that this is not just giving me knowledge, but I'm leaving with a skill, right? I'm leaving with that ability to then apply this to a case, whether that be, in this situation, you're flexing your own kind of critical thinking skills and you're really getting to go back and, try these cases and work through the process and then, try again if that's what needs to happen. But at the same time, we can also then have you go back to those resources, like Teresa said, and go back to the things that have already been done and are there for you to kind of deepen that. But then on the flip side, you can take what you've learned and you can apply it, and you can then say, okay, now let's take that to that next step with a case. So, you know, clinical reasoning isn't just built on what we know, but it's also on that application piece. So things like that errorless learning, like we talk about, it's really just getting to that why behind what are the right choices, getting that immediate feedback, and also giving you the, hey, this is why that was the recommended pathway. Really, you know, just kind of sticking with that evidence-based background. And so really just making sure that we're sending you to the why behind, you know, what this case-based learning is really going to do for you, but then also not just sitting and listening, but actually reading, watching like a simulation of a therapist working with a client for a certain component of that case, and then going through and reading and kind of picking your decision, and then basing it on that and seeing some immediate feedback about your answers. So that's really what's kind of coming forth, and what you'll see is one of the changes coming forward. And I should say that these are being written, although I'm here the one talking about it tonight, the first one was written by the lovely George Barnes, who is such an expert in all things medical-based SLP, and I do not want to be taking the credit for something that I did not create, although the idea for this active learning pathway was something that I brought up. This has definitely been created by George. So all the credit to George for the first one that you're going to see here in the collective as well, just bringing his immense clinical expertise to the forefront to help us kind of grow together. And again, I think it just aligns really great with that philosophy that we have in the collective, that we all can grow and we all can learn, and that we're here to do that in a supportive way. I feel like this kind of learning pathway really helps to be able to solidify that for members, you know, students, universities, you know, any of those members across that continuum that we have in the collective. So we can give you guys a little bit of a example of what you're going to see, a sneak peek of one of them, because I see that's one of our questions, but we're not necessarily going to be able to show you the whole thing, because like Teresa said at the very beginning, these will be bundled together for CEUs, so we can't give you all of the answers for what they actually would do. So we won't walk through an entire one together, but we will walk through kind of part of it to kind of give you a sneak peek behind the scenes. So let me see if I can.
Do you have sharing privileges, Kristen?
That's what I was just going to say. Do I actually have the sharing privileges? I think, yes, I do. Can you see that? Is it viewable? Everyone? Yes?
Yep.
We're good. Okay. So there's different parts of this that you'll see, but each one will kind of start with an orientation, which I haven't kind of put you there, but you'll get a little bit of an overview of the case, an overview of the client, the situation that you as the SLP find yourself in, and kind of what you're tasked with doing. So in this situation, this is a patient that has a really medically complex history, and we're looking for factors for aspiration pneumonia, and kind of determining, you know, how are we at this kind of initial order of concerns for aspiration pneumonia going to kind of navigate the care of this patient. So you kind of get a nice orientation. For those of you that have any experience in higher ed, sometimes we call that the pre-brief, but it's really an orientation to the clinical scenario, which you kind of get first. This is kind of the next part, which is why I skipped ahead to it, was really just saying, okay, you've kind of been oriented to this client. He has a couple, you know, significant medical histories that you'll see as soon as I, didn't go back to the one I wanted it to, that come into play. And then they're going to ask you, like, which ones of these are the most important thing for us to document? So there's a little video that I'll play first.
My name is Alex. I'm a speech language pathologist. I'm here to evaluate your swallowing and see if I can help.
Thanks, Al. It's nice to meet you.
Let's talk a little bit about your past medical history.
And so it'll give you a little prompt like that, and then we'll be able to go through some of the past medical history, review it, and then make determinations about what is the, you know, the correct answer. So for this individual, he has some history of mobility issues, prostate cancer, gastroesophageal reflux, you know, and a whole host of other things. And we kind of have to say, okay, so in this situation, which ones are the most significant ones for us to consider? So if I were to make an incorrect choice, it's not going to necessarily tell me, but it's going to say, this isn't wrong. Think about these pillars of aspiration risk and consider how that would guide your decision. So then you'll have an opportunity then to go back and be able to say, okay, well, based on that information, it actually should be things more related to, gastroesophageal reflux and his COPD, his respiratory failure, and his use of high flow nasal cannula. And so then you can kind of navigate through the next part. I'm going to skip ahead just to see. And so then based on what you know of his history and in this next video that we could play through again.
I understand you've been through a lot lately. Can you tell me how you're feeling?
Well, I've been feeling tired a lot lately, and sometimes I have trouble breathing.
So then based on that, we would say, okay, what do you want to consider asking Marco next? And so, do we want to know about a surgical history? Do we want to know about what aspects of his feeding, difficulties are we going to ask about and keep progressing through? So I can't kind of give you the whole series because it kind of keeps going. But as you kind of keep moving through, you would move through the situation where you'd ask more questions, you'd determine what types of assessments that you would want to implement, you would get the results of those assessments, and then you'd be asked to make a clinical determination at the end about what you're going to do with Marco based on the findings of his assessments. If you make something that's not supported by like the literature or an incorrect pathway, then it will just prompt you, like I kind of showed you before there, that it'll say, consider these factors. And depending on what the answer is, it might prompt you differently. Like that one prompted you about pillars of aspiration, but it might say, oh, consider these facts, or what do we know about the findings of, his clinical assessment or his instrumental assessment? What would you like to, what do we know and why, and kind of linking you back to either resources or literature or best practice to really help you work through. So that's kind of a little glimpse behind the curtain. Again, we're not going to be able to walk you through an entire one because that would be giving the answers. And this is going to be one of the ones that's bundled for CEU credit moving forward. But I think it kind of gives you an example of what you'll be seeing coming through as these kind of case-based simulation scenarios that are going to be emerging as part of, not just the only thing, but part of the new updated offerings in the collective.
Yes. So I will just clarify for any members of the collective, these are now live within your dashboard inside the collective. If you are someone that is not yet a member of the collective, you can go to medslpcollective.com and join us. We will be putting a few of these out each month, and they will be bundled for CEUs. So you'll have to do a few of them in order to get the CEUs for them. These also, we are also going to be offering these to grad programs too, to be able to use for clinical hours. And Kristen is in charge of our university programs as well. So if there's anybody that works at universities and want to figure out how to integrate this in your program, please do reach out to her. But I'm so excited to release this and put this out into the world because I'm just so excited that this is where we're going with inside the collective. So this is just night one. Night one, we are revealing the simulations. Tomorrow night, we will be revealing our new demo and discuss feature as well. We will be bringing on Dr. Amanda Gillespie with conversation training therapy and Dr. Jessica Pisegna with, she's going to be performing a fee. So they're literally going to just be showing you exactly what to do. So like I said, we have a whole library of webinars and resources if you need all those brain dumps, if you need to read all the research behind things. But now we are shifting, as Kristen said, to more of an active learning model, more of a social learning model where you just get to see the things done. You get to quiz yourself, you get to ask questions, and you just get to see the things done. So I'm really, really excited. That is where we are moving to. So like I said, for current members, this is now live on your dashboard. If you are not currently a member and would like to join us, you can join us at medslpcollective.com. If you join by next Friday, you'll also see we have a whole host of bonuses. All of our clipboard kits, things like that are all available to you to download for bonuses. We have clinical pathways for SNF, home health, hospitals. And then if you join also by next Friday, we will be sending you one of our badge buddies and badge reels, which everybody knows and love. And tomorrow night I'll have one handy. I did not think to bring one tonight, but Kristen, do you have anything else to share? Thank you so much for that really, really awesome description of why we're doing this. So I hope you guys are excited about this. We're super excited about it. I think it's going to be really great, a really great learning experience for all of us.
No, I'm just excited. I think, active learning is just such, what we've all been looking for for quite some time. So I'm just really excited to be part of that and be contributing. And I'm excited to see the demo and discusses because I love to learn this way too. So I'll be joining on the other side of the Zoom for the upcoming days.
Excellent. Excellent. Just a few other questions that have come in. Yes, the rest of the live webinars that are going on this week. So tonight was not for CEUs, but tomorrow night, Wednesday night, and Thursday night will be for CEUs. And also they will be housed inside the collective if you are a member. You can get the CEUs that way. If you're not a member and you don't decide to join us, you can still watch the recordings through till next Friday. And then yes, to get all of the bonuses, all you have to do is join us at medslpcollective.com. So please let me know if you guys have any other questions. I'm happy to answer. And if you don't have any other questions, I would just love to hear how excited you are about all of these new things we're rolling out because I am super excited. Oh, hi, Chandler. So good to see your name pop up after all these years. God, Chandler, you were probably one of the OGs too. You've probably been a member 8 years ago as well. Oh, I love this.
So many messages.
Yay. Awesome. Thanks, you guys. Really, really, really excited. Sarah's been here since the beginning too. Amazing. Love that. Love active learning. Awesome. Thanks so much, you guys. And thank you for, supporting us and being, loyal members of the collective all these years. That's what allowed us to make these big changes and to allow us to pivot the way that, the market demands, that you guys demand. And again, I just can't thank you guys enough for elevating your practice, which challenges us to continue elevating to meet your needs as well. So yay. Thank you guys so much. And let us know if you have any questions. You can always email into support@medslpcollective.com if you have specific questions. If you're not a member, please join us at medslpcollective.com. If you are a member, please go inside your dashboard and check this out. Otherwise, we will see you tomorrow night at 7 o'clock again, 7 o'clock Eastern again, for our new other feature that we're rolling out, the demo and discuss feature, which I'm really, really, really excited about as well. So Kristen, again, thank you for your time, your guidance, your wisdom, your brain, all of it.
Yeah.
All right. Thanks.